Type 1 diabetics, unlike type 2, cannot make their own insulin. Type 2 diabetics have too much insulin, and some of their cells in their body does not respond to insulin's call. Type 1 diabetes is an autoimmune disease. There is no cure for that. So a type 1 diabetic has to take insulin from the outside and inject it into themselves so that they can live. Type 1 diabetics are usually diagnosed in early childhood, but they can also be diagnosed in their 30s. Now, there's also adults, full grown adults, who are also type 1 diabetics. That's called LADA, latent autoimmune diabetes in adults. Now, as I said, type 1 diabetics cannot make their own insulin, but type 2 diabetics, they not only have too much insulin in their body, they also have a situation where some of the cells in their bodies will not respond to insulin. Type 2 diabetics have too much insulin, and some of their cells do not respond to insulin the way that they used to. Type 1 diabetics cannot make their own insulin. It has to come from the outside, they inject it in. Now, I have issues with when children are diagnosed, or even adults are diagnosed as type 1 diabetics. They should be told at the time of diagnosis that a low carb diet would benefit them tremendously. Why? Type 1 diabetics can't make insulin. So the standard American diet, the standard Western diet, is not really good for them because it's high in carbohydrates. So, as a type 1 diabetic, since you have no insulin, you can't make it. When you eat a food that's high in carbohydrates, sugar flies up. Now you have to go and take insulin and try to understand how much insulin to inject in yourself to control that high amount of carbohydrates. But if you were to eat a low carb diet, if you were to adopt a low carb diet, think about it. That would mean that when you consume a food, a low carb meal, you would have to inject less insulin into your body. Think about it. Your child has been diagnosed as a type 1 diabetic. Instead of feeding your child the standard American diet, standard Western diet, that child is introduced to a low carb diet. That low carb diet means that the spikes that they usually would get from the standard American diet, they're not going to have that. It means now they have to inject less insulin, which means that child, as they grow up, they get older, may not become obese because of the amount of insulin they have to inject into their bodies. I try to keep it simple, right? It's complicated, but I try to keep it simple. But if you're a type 1 diabetic, if you adopt a low carb lifestyle, it means that the foods that you are going to eat will not cause you to have insulin spikes.